An expert on police use of force says better collaboration between 911 dispatchers, Winnipeg police, and local emergency services may help prevent future deaths when it comes to addressing calls for people in agitated and distressed states. The remarks were entered onto the record as part of an ongoing inquest examining the deaths of Patrick Gagnon, Michael Baggett, Sean Thompson, Matthew Fosanoff, and Randy Cochran, all of which would die following police interactions in Winnipeg in less than a year. All 5 of the men were distressed at the time of their death. Quote, as we look at a response to somebody who is in this state, it starts with the dispatchers receiving the call, end quote. That's what Sergeant Kelly Keith, an expert in police use of force and training, told Judge Lindy Choi as he testified Baggett and Thompson may have been helped by a unified response between emergency personnel. Keith explained when it comes to people in a state of hyperactive delirium and agitation, more interagency training is needed so police are able to identify symptoms of a person in distress quickly and notify 911 so they can dispatch advanced care paramedics at the same time. Quote, if this is automatically engaged in times where there's enough of a belief that it could be this situation, it could reduce the time for Winnipeg Police Service to have to hold somebody down on the ground, end quote. Once controlled, he says the sooner a paramedic is on scene, the sooner sedation can be administered, saying sometimes when people are in an agitated state, they're unable to feel pain, meaning some hands-on restraints wouldn't be as effective. He says the training would create a more proactive response to people who are experiencing symptoms of this nature. The inquest continues Tuesday. In Winnipeg, Morgan Majeski, City News.